This is BayRadio, where we welcome a wide range of guests as far as interviews go, and it's our job to inform as well as entertain, and I think we're all about to learn something as we get to talking about stem cells with Dr. Leon Donoso from Hospital San Carlos. Now, this is HLA San Carlos in Genia, correct?
That's correct, yes.
Welcome along. Thanks for your time, because, as I say, this seems quite complicated, and how do you begin explaining what stem cells are? A lot of us will know the term, maybe have some idea, but how do you explain it? What are they?
Okay, well, stem cells are cells that do not yet have a specific role and become almost any cell that is required. These cells are undifferentiated that can turn into specific cells as the body needs them, can also show promise for treating some diseases. Sometimes these cells are called master cells. These cells are cells that develop into the blood, brain, bones, and all body organs. They have the potential to repair, restore, replace, or regenerate cells and could possibly be using to treat some diseases at the moment that are not curable.
I guess in Spanish they are células madre.
That's correct.
So that means they're kind of the root of it, as stem cells would indicate. Because cells develop and they break out into other cells.
Exactly.
But this is where it all starts, right?
Yeah,
with
that's
the stem
all
cell.
start. Yep.
Okay, so it can go on to be used for lots of various things in the body. But where are they located then? How do we go about, or how do you go about finding them?
Well, these cells are most commonly found in the blood. Right? So to get them, we have to harvest these stem cells, removing blood from the body, separating out of the stem cells, and then returning the blood back to the body. To boost the number of stem cells in the blood, we use some growth factors that stimulate the production of the stem cells about 4 or 5 days before the treatment can be done. That is one way. And another way is removing them actually from the bone marrow, especially in the bones, mainly the hip. This is where they divide to make new blood cells. And when blood cells are mature, they leave the bone marrow and enter in the bloodstream.
Now, I've heard of stem cell donation. So is this something that people can donate to other people, or are you taking them from the patient and reusing them?
I mean, and the way we do it is we take the blood from the own patient. Mm-hmm. But as far as I understand, it can also be donated, but this is a more complicated process because there are lots of law involved in the donation. But as far as we know, and what we do is we use the patient's own cells.
Now, in some of the cases you've given us, and you've talked about that you've actually carried out at the hospital there, lots of use in circulatory problems, particularly in the legs, as we're going to talk about. So how can they be used then? What are the main uses once you've got the stem cells to work with?
So, the way the stem cells work in the circulation is as follows. Basically, if you have pain when you walk, right? This is the main indication that you have lack of circulation in your leg, right? So when you walk and you don't have enough blood because the artery has been blocked partially or completely, right? The muscles complain and complain with pain. Therefore, the patient has to stop. Every 50 yards, 100 yards, or whatever distance is called basically the window to wait until the pain disappears. So when you have this sort of patient, then there are several possibilities to treat the pain, to alleviate the pain. One is surgical procedures, basically a bypass operation, an stent operation of the best medical treatment. Once you have done all this treatment and you cannot improve the pain of the patient, then unfortunately the patient can go for a major amputation. So this is the group of patients that we are working with the stem cells to avoid basically big amputation. That is a mutilating surgery.
Life-changing,
Of course. I mean, you have to know that if you have an amputation, the patient can go for the other leg amputated in 2 years, and in 5 years, all are dead. Therefore, to avoid an amputation is absolutely important.
Yeah. What other types of treatments would it be used for? I mean, we're talking tissue repair.
Yeah. We have about tissue repair. Tissue regeneration is probably the most important use of stem cells. For example, now we have used some stem cells to renew the kidney, right? At the moment, of course, the patient with a renal failure is waiting for a transplant, but in the future, not too far away, we will be able to implant kidney stem cells to renew or promote new regeneration of tissue or the kidney tissue. In the cardiovascular field, also, we have been working, as I said, in the stem cells with ischemic legs, but in the cardiac point of view, there are some studies now that they have improved the ejection fraction by injecting stem cells in the myocardial muscle, regenerating cardiac cells, improving a lot the distance of walking. There are also other techniques, for example, in brain disease treatment to treat Parkinson and Alzheimer's, and
really?
More frequently they are treating now arthrosis of knee arthrosis or any sort of arthrosis, replacing the chondrocytes with stem cells.
It's interesting you talk about like the kidney, because do we see this elsewhere? Not to go off at too much of a tangent, where they're producing like fake meat from stem cells. It's a similar sort of process, isn't it?
Well, I mean, it's some related, basically. Yeah.
Because it's the foundation of what the thing is growing from. These cells.
So the stem cells are basically the beginning of everything.
Yeah.
So if you can pick up them either from the bone marrow or the blood or any other source, even the fat tissue, then you can have the opportunity to promote and develop a lot more cells to treat different diseases.
It's an awkward question probably, but how long does it take to work, to come into effect? Does it take a long time for these cells to develop?
That's a very good question, actually, and I don't know the answer.
Right, okay.
I'll tell you
why. Are we talking a long time? Or?
Because when we have a patient with what we call pain when we walk, let's say 50 yards, perhaps less than that, then the body itself start producing more stem cells to go to the place to replace the arteries that have been blocked, and that is produced because of the muscle pain, right? Send some signals to the bone marrow to produce these stem cells. But how long does it take from the bone marrow to go to the specific area? We don't know.
No.
What we know basically is that now we take the blood from the bone marrow from the hip, we process in the same operating theater, right, and we inject, as I will explain in a minute, exactly in the place where it's needed.
Right. Okay. So it goes directly there. Yeah.
I always try to explain like a simple example. We live in Valencia where there are lots of oranges. So what we do, we go to the orange field, right? We pick up the oranges and we deliver in your house.
Sure.
Right.
Okay.
So by doing that, we avoid the middleman. Basically, the middleman in our case is the supermarket and the cooperative that keeps the blood. So that it takes a long time. But so avoid the middleman, and we try to put exactly in the place.
Straight to the location. Yeah.
Exactly.
Okay. But as you say, the body knows. It's a bit like see when you train muscles, they actually destroy the muscle, but they regrow stronger.
That's
and
right.
The body knows to send it to that place that's been affected. I guess these cells are rebuilding, right?
Exactly, that's
and
correct.
Stronger than they were before. That's the idea, anyway. Now, how new is this to San Carlos in Denia? A procedure?
I mean, we have been doing this treatment just for a few years by now, but not exactly in San Carlos Clinic, because I used to work in a Hospital de la Ribera in Alcira in Valencia, right? And we started this treatment in Valencia about 4 years ago. And so far, we have done approximately 45 patients, right, in this treatment. And some of them we done here in San Carlos Clinic. You have to understand that these patients were patients that were unavoidable to have an amputation, a major amputation. And the only way to relieve the pain, right, that the patient is having is amputating. So we decide to continue and to go with this treatment. And so far, for the 44 patients that we've done, about 80% keep the leg.
Wow.
They still have the leg. Of course, they are not running a marathon,
No.
but at least they have come out of the rest pain that is unbearable, and then they are managed to go 200 yards. And when you manage to walk one or 200 yards, the body itself, right, the exercise that you do, promote more growing of the new vessels.
Yes, you
And
adapt,
that, in
you
that
adapt
way
to it.
helps
Yeah.
enormously.
Yes, and
So
then you should, in theory, you should be able to do more next time.
Yeah, excellent.
Right.
Only about 4% of the patients that we couldn't heal, and unfortunately underwent a major amputation. But these patients were patients not only with rest pain, but also with gangrene.
Right.
So severe lesions in the leg that is basically very, very difficult to heal.
But it was worth a try, definitely.
Oh,
with
yeah,
this.
definitely.
It's always worth
I
trying.
think so.
Is it, presumably it's not a painful procedure for the patient? Doesn't it
Well,
sound like
yes, we use epidural anesthesia, right? Of course, the anesthetist is in charge of that. And the puncture in the hip bone definitely has to be painful if we don't do some sort of anesthesia. The hematologists usually only put local anesthesia, and they do the puncture to remove the bone marrow. But as we are going to do 40 injections in the leg, right?
Okay.
Then we ask anesthetist to sleep the patient or put the patient under epidural anesthesia. Therefore, it's not painful for the patient because it's anesthetized. So we remove 200 ml of bone marrow. We process in a device that's called harvest in the same operating theater, and from the 200 ml that we process, we discharge the plasma, the platelets, the erythrocytes, the excess of fluid, and we end up only with 40 ml of what we call stem cells. And then we inject 1 centimeter at a time and 1 ml at a time along the leg.
Right. Okay. I mean, how long does that take to separate out the stem cells from
It's
the
20
sample
minutes.
you've taken? Is that all?
Just 20 minutes.
Yeah,
The
so
time
it's
that
not
you have
days,
the spinning fast machine that separate that in 20 minutes.
Wow.
So it's basically that is the advantage of doing in the same operating theater.
Mm-hmm.
Otherwise, if you have to take the blood outside of the theater, the operating theater, then it's a different process. There are more problems involved, and then you have to have a specific permission to do that.
I mean, we've talked about mostly you treating patients with circulatory problems in the legs. This is the future, isn't it? This is the way it's going to treat lots of other things that we've already talked about, I guess.
I think it's the future not only for these problems, but for many others. Now, for example, they are treating patients with retinitis pigmentosa. You know that this is a blind disease that produces blindness. Mm-hmm. So they are now injecting stem cells to replace the cones in the eye to help the people to start seeing again. So, yeah, there is the future. You have to remember that we are coming from cells.
Of course.
So why not treat the diseases with cells?
Yeah.
I am a surgeon.
Yes, well, quite, yes. And you've explained it to me so well, as you say, it's the way it's going, and fascinating to talk about, nicely explained by yourself. Thanks ever so much. It's Dr. Leon Donoso from the HLA San Carlos in Denia.